The trauma unit was loud in the way hospitals are loud at night. Not chaos. Not panic. Just constant machinery pretending to be calm. Monitors pulsed steady green lines. Ventilators exhaled patient breaths in soft mechanical sighs. Rubber saws whispered across polished floors. Somewhere down the corridor, a metal tray clattered once, then silence swallowed it again. No one noticed the new nurse. She had signed in 12 minutes earlier. No introduction. No small talk. She took the badge from staffing, clipped it to her pocket, and walked straight into Trauma Bay 3 as if she had worked there for years. Float? A resident had asked without looking up from a chart. Yes. That was all she said. Now she stood at the supply counter, checking 4 tubing. Not scanning. Checking. Her fingers moved methodically, eyes tracing connection points, expiration dates, seal integrity. She set aside 2 lines without comment, replacing them with sealed ones from a lower drawer. No announcement. No correction. Just adjustment. Across the room, 2 nurses discussed weekend plans. A paramedic leaned against the wall finishing paperwork. A tech scrolled quietly through lab results. No one watched her. Which was why she could watch everything. Her gaze moved slowly, not like curiosity, like inventory. Exit door. Crash cart. Oxygen ports. Sharp container fill level. Security camera dome angle. Distance between beds. She didn't stare. She registered. A gurney rolled past outside the bay. She didn't turn her head. Only her eyes shifted slightly, catching the reflection in the glass cabinet. Wheels slightly misaligned. One bearing dragging. She filed it away. A monitor alarm chirped once from another room. She counted the seconds before it was silenced. 4. Good response time. She picked up a pair of gloves, stretched the latex once, then put them down again. Not needed yet. Her posture stayed relaxed, but her weight rested evenly on both feet, knees loose, shoulders low. Not fatigue posture. Ready posture. Most people didn't know the difference. Hey, the resident said suddenly, glancing toward her badge. What was your name again? She looked at him. Aaron. He nodded once. Already forgetting. We're backed up tonight. Probably boarding 2 admissions in here. Sorry in advance. That's fine. Her voice was even. No complaint. No enthusiasm. Just acceptance of information. He went back to his chart. She watched his hands for a moment, not the chart. His hands. Ink stain on the side of his finger. Slight tremor in the ring finger. Dehydrated. Over-caffeinated. Near end of shift. Useful to know. Down the hall, ambulance doors opened. Not loud. But different. Most ambulance arrivals sounded rushed even before they entered. Footsteps fast. Voices layered. Radio chatter overlapping movement. This one did not. She tilted her head slightly, listening. One set of wheels. Heavy. Steady pace. No overlapping voices. Her eyes shifted to the wall clock. She counted silently. 1. 2. 3. The doors at the end of the corridor swung inward. Still no shouting. Interesting. The paramedic inside Trauma 3 kept writing. Probably another minor MVA, he muttered. They've been stacking all night. Aaron didn't answer. She stepped closer to the bay entrance, not approaching, just adjusting position so she could see the hallway without standing in it. Her breathing stayed slow. Footsteps approached. Not rushed. Measured. Rubber soles. Boots. Rubber again. Mixed footwear. Her eyes lowered briefly to the floor reflection. Multiple people. Not family. Not standard EMS pattern. The resident didn't notice. He was explaining lab values to the tech. Erin's gaze moved once across the room again. Exit still clear. Crash cart unlocked. Defibrillator charged. She reached out and rotated the overhead procedure light 2 inches to the left. No one saw her do it. The hallway footsteps stopped just outside the bay. Silence followed. Not hospital silence. Held silence. The kind people make when they're waiting for permission without asking for it. The paramedic at the desk finally glanced up. "You expecting someone?" "No," the resident said. Erin said nothing. A shadow crossed the threshold glass. Then another. She watched the reflection, not the doorway. One shadow shifted weight to the back foot. Guard stance. Her fingers rested lightly against the rail of the empty gurney beside her. Not gripping. Resting. The doors began to open. And for the first time since she arrived. Her eyes sharpened. The doors opened slowly. Not pushed. Guided. 2 paramedics entered first, rolling a stretcher between them. Their movements were controlled, almost careful, as if speed had been intentionally removed from the situation. Behind them walked 3 uniformed court security officers. Not hospital security. Different posture. Different spacing. They didn't speak. They didn't look around like visitors. They scanned. Most people wouldn't notice the distinction. Hospital staff saw uniforms and categorized them the same way they categorized equipment, background presence. Erin watched their feet. One officer stepped heel-toe, evenly weighted. Trained gait. Another kept his right side slightly back, dominant side protection. The third never let his hands drift far from his beltline, even while walking. Not casual escorts. Structured. The resident looked up, surprised. Trauma 3's open." No one answered him. The stretcher rolled in. The patient was male, mid-40s, pale beneath streaks of drying blood. A compression bandage wrapped his neck. Oxygen mask. Wrist restraints, soft medical type, but secured with tight, deliberate knots. Erin's eyes paused there. Not standard EMS tie. Intentional restraint. She stepped forward. Not hurried. Not hesitant. "Transfer on 3, one paramedic said. His voice was steady, but the rhythm was off. Too measured. Like someone reading a line they'd practiced. They moved the patient to the bed. The officers positioned themselves automatically, one near the door, one near the foot of the bed, one offset to the wall. No discussion. No visible signals. Formation. The resident began his assessment. "What V we got?" "Male, found unresponsive. Suspected trauma. Blood loss unknown. Mechanism?" The paramedic hesitated. Half a second. "Fall." The word landed flat. Erin adjusted the 4-pole height 2 inches. No one noticed. The resident frowned slightly. "From what height?" "Unknown." Another half-second pause. Erin glanced at the patient's shoes. Not hospital. Not work boots. Not casual. Institutional issue. She looked at the officer nearest the wall. His eyes were not on the patient. They were on the hallway. Watching approach angles. She shifted the supply tray closer to the bed, placing gauze within immediate reach of her left hand. Still no one watching her. The cardiac monitor cables lay coiled beside the mattress. She separated them silently, aligning the leads in order of placement. Red. Yellow. Green. Black. The paramedic continued his report. Vitals en route stable. Brief drop in pressure. Regained. What caused the drop? Movement. What movement? Another pause. Transport movement. Not wrong. Not an answer. The resident didn't push. He was already focused on the neck wound. Let's cut this dressing. Aaron handed him sterile scissors before he asked. He took them automatically. Her eyes lifted briefly to the officers again. Still silent. Still watching. One of them shifted his stance slightly when the scissors appeared. Not fear. Readiness. She filed that away. The bandage came loose. Blood seeped slowly through the gauze underneath. Not arterial. But deep. The resident leaned closer. That's not from a fall. No one replied. The heart monitor began its steady rhythm tone as Erin attached leads to the patient's chest. Her hands were precise, economical. She didn't waste motion. She didn't hover. Touch. Place. Press. Done. The patient's eyelids fluttered. Tiny movement. She saw it before the monitor registered the heart rate change. Her voice was calm. He's coming up. The resident looked at the screen. Yeah. But Aaron was watching the officers. All three had seen it. All three reacted the same way. Stillness. Not relief. Anticipation. The patient's fingers twitched against the restraint. One officer's jaw tightened. The resident kept working. Let's get a pressure. Aaron already had the cuff wrapped and inflated. Numbers appeared. Low. Holding. She adjusted the bed angle 5 degrees. Better cerebral flow. No announcement. Just correction. The paramedic handed over a clipboard. That's all we've got. The resident scanned it. His brow furrowed. This report's missing half the fields. No response. He looked up. Where's intake documentation? Silence. Aaron took the clipboard gently from his hand. Her eyes moved across the page once. Patient name field. Blank. Transport origin. Redacted. Incident location. Code string. Not hospital coding. Not EMS coding. Federal formatting. She handed it back without comment. The patient's eyes opened slightly. Clouded. But aware. He didn't look at the doctors. He looked at the officers. And the officers looked back. Something passed between them. Not words. Recognition. Aaron reached over and loosened the oxygen mask strap by half an inch to ease airway tension. Her movements were gentle. Routine. Invisible. But her mind had already finished assembling the pattern. Incomplete paperwork. Structured escort. Restraints tied by trained hands. Silence instead of explanation. And a patient who wasn't afraid of the people guarding him. Which meant this wasn't medical transport. This was custody. She didn't react. She didn't stare. She simply adjusted the light angle again so it illuminated the patient's neck wound more clearly. And left the officers in partial shadow. The room settled into working rhythm. Monitors spoke in steady tones. Packaging peeled open in soft, papery sounds. The resident dictated observations under his breath as he examined the wound. Someone outside laughed faintly down the corridor, unaware of the gravity collecting inside Trauma 3. Aaron stood at the patient's left side. Not at the head. Not at the foot. Left side gave her sightlines, door, officers, hands, airway, instruments. Balance point. The patient's breathing was shallow but controlled. Not the breathing of someone panicking. Not the breathing of someone confused. Measured. He knew where he was. She placed 2 fingers lightly at his wrist. Pulse, thready, but disciplined. His body was compensating, not collapsing. Interesting. Most trauma patients fought the body's instinct to stabilize. Adrenaline surged. Muscles clenched. Breaths turned ragged. This one conserved. The resident irrigated the wound. I don't like this. Depth's wrong for blunt trauma. No one answered. The officer near the door shifted half a step closer. Not aggressive. Protective. Aaron reached across the tray and repositioned the saline bottle so its label faced away from the doorway. Then she moved a metal instrument dish 2 inches to the right. Space cleared. Angle opened. No one registered the change consciously. But the working area was now tighter, cleaner, more defensible. The patient's eyes opened again. This time they focused. Not on the resident. Not on the lights. On her. His gaze was sharp despite the blood loss. Assessing. Sorting. She met his eyes briefly. Neutral expression. No curiosity. No sympathy. Just presence. He blinked once. A signal? Reflex? Pain response? She didn't assume. She checked his pupils with a penlight. Equal. Reactive. Neurologically intact, she said quietly. The resident nodded. Good. One officer watched her now. Not casually. Directly. His attention wasn't drawn by her voice. It was drawn by her timing. She had spoken before the doctor asked. Correctly. Without hesitation. His eyes moved once over her posture, her hands, her face. Evaluating. She ignored him. The cardiac monitor tone shifted slightly as the patient adjusted his breathing. Aaron's gaze flicked to the waveform. Sinus rhythm. Stable. But tension sat underneath it, microvariations that didn't match blood loss alone. Stress. Controlled stress. She leaned closer to the patient, voice low enough that only he could hear. Stay still. Not instruction. Calibration. His eyes held hers. Then, very slightly, he nodded. Compliance. Immediate. Across the bed, the resident frowned at the wound again. I need better light. Before he could reach for the handle, Aaron adjusted the overhead lamp. The beam tightened perfectly over the injury. No glare. No shadow. He paused, noticing the precision. Thanks. She inclined her head once. The officer at the wall shifted his stance again. His attention sharpened. People who worked protection noticed efficiency the way surgeons noticed bleeding. Instinctively. Automatically. He was beginning to notice her. The paramedics finished transferring equipment data to the chart tablet. One of them cleared his throat. We'll be heading out. The resident waved absently. Yeah, thanks. But none of the officers moved. They remained exactly where they were. Anchored. The paramedic hesitated, then looked toward them. You staying? No answer. The silence that followed wasn't awkward. It was structured. Like a perimeter. Aaron's eyes dropped briefly to the patient's restrained wrists again. Skin beneath the cuff was slightly indented but not bruised. Whoever tied them understood circulation thresholds. Professional restraint. Not hospital. Not police patrol. Higher training. She adjusted the blood pressure cuff and reinflated. Numbers rolled. Lower. She watched the waveform stabilize before speaking. Pressure drifting. The resident glanced. Fluids ready? Already hung. Already primed. Ready. He gave a short nod and returned to the wound. The officer near the foot of the bed finally spoke. Is he going to make it? His tone was controlled, but it wasn't casual inquiry. It was operational need. The resident didn't look up. Depends how much blood he lost before arrival. The officer's jaw tightened. Aaron answered instead, voice calm. He is compensating well. Both men looked at her. The resident blinked once, then returned to work. The officer held her gaze half a second longer. She didn't elaborate. Didn't soften it. Didn't challenge him. Just gave the assessment. Clinical. Certain. He accepted it. Not because of her badge. Because of her tone. Silence returned. Outside, a cart rattled past. Someone called for respiratory therapy over the intercom. The ordinary world continued moving, unaware that something inside this room had begun to tilt. The patient's breathing changed again. Shallower. His eyes shifted, not to the officers this time. To the doorway. Aaron saw it instantly. Her hand rested lightly on the bed rail. Not gripping. Ready. She didn't turn toward the hall. She watched the reflection in the stainless instrument tray instead. Movement. Approaching. Multiple. Not staff. Footsteps stopped just outside. The officer by the door straightened a fraction. The patient's pulse ticked faster beneath her fingers. Aaron spoke quietly, almost conversationally. Do not move. The patient stilled. Total compliance. The door handle began to turn. And this time, everyone in the room noticed. The door opened halfway. Not fast. Not cautious. Controlled. A fourth officer stepped in. Older. Plain uniform. No visible rank markings, but the others registered him instantly. Tiny posture shifts, subtle straightening, attention tightening without a word spoken. Command presence. He didn't speak at first. His eyes moved across the room once, taking inventory the way experienced field supervisors do, exits, personnel, hands, equipment, distances. They stopped briefly on Aaron. Not lingering. Just noting. Then he looked at the patient. What's his status? The resident answered automatically. Penetrating neck trauma. Blood loss moderate. Stable for now. The officer nodded once. He stays secured. It wasn't loud. It wasn't aggressive. But it wasn't a suggestion. The resident hesitated. We need access to the arms for line placement. He stays secured. Same tone. Same volume. The room felt smaller. Aaron didn't look at the officer. She looked at the restraint knot. Then at the patient's fingers. Capillary refill slightly delayed. She spoke calmly, eyes still on the patient's hand. Left wrist needs release. The officer closest to her turned. Negative. She didn't react to him. Didn't meet his gaze. Didn't acknowledge him. She addressed the air, the way medical staff do when stating facts instead of opinions. Circulation is restricted. If perfusion drops, he loses the arm before he loses blood pressure. The resident glanced between them. He didn't like tension. Most physicians didn't. Conflict complicated treatment. The senior officer stepped closer. He stays secured. Aaron finally lifted her eyes to him. Her expression didn't change. No challenge. No submission. Just direct attention. If circulation fails, she said evenly, you will be guarding a corpse with one less problem and several more reports. Silence. No edge in her voice. No threat. Just outcome. The officer studied her face. People often mistook stillness for passivity. Experienced operators didn't. They recognized evaluation when they saw it. Behind him, one of the other officers shifted his weight slightly, attention sharpening again, not toward her tone, but toward her certainty. The resident cleared his throat. We really do need access for a line. The senior officer didn't look at him. His gaze stayed on Aaron. How long, he asked, before circulation fails? Minutes, she said. Not rushed. Not dramatic. Precise. He considered that. Not emotionally. Logistically. Aaron lowered her gaze back to the restraint. Still waiting. Not reaching for it. Not touching it. Respecting the chain of authority in the room. That restraint mattered. The officer knew it. She knew it. Everyone knew it. Which was why she hadn't moved. Yet. The patient's fingers twitched. Subtle. But visible. She spoke again, softer. Time is tissue. A phrase every medic, nurse, and field operator understood. The officer's jaw shifted once. Decision point. He glanced down at the restraint. Then at the patient. Then back to her. What happens if he wakes fully? Her answer came immediately. He stays still. Not confidence. Certainty. The officer's eyes narrowed slightly. You can guarantee that? No, she said. Honest. Flat. I can manage it. That answer landed differently. Guarantees were sales language. Management was operational language. He watched her another second. Then. Release one wrist. The officer beside her hesitated. Sir. Do it. No volume change. No force. Just authority. The strap came loose. Aaron's hand moved in the same motion, not fast, not slow, guiding the patient's wrist onto the mattress in a neutral position that preserved both circulation and control. Her fingers adjusted angle, tendon alignment, palm orientation. Secure. Without restraint. The patient did not resist. Did not flex. Did not test. He obeyed. Immediately. The senior officer noticed. So did the others. So did the resident. Aaron was already swabbing the exposed arm for 4 insertion. Alcohol pad. Circular motion. Vein assessment. No wasted movement. The officer who had objected earlier spoke quietly. He's compliant now. That can change. Yes, she said. No argument. Needle in. Flash. Catheter advanced. Tape placed. Fluid line connected. Flow open. All in one smooth sequence. Her hands never trembled. Never rushed. Never paused to check if anyone was watching. Because she wasn't performing. She was working. The cardiac monitor tone steadied slightly as fluids entered the patient's system. The resident exhaled through his nose. Good line. She didn't answer. Her eyes had shifted back to the patient's face. He was watching her again. Not like a victim watching a caregiver. Like a professional watching another professional. Measuring. Confirming. Across the room, the senior officer noticed that look. He followed it. Saw the silent exchange. Something in his posture changed. Not alarm. Recognition. He stepped half a pace closer. Have you treated detainees before? He asked her. It sounded casual. It wasn't. Aaron disposed of the needle in the sharps container. Click. Yes. How many? She pressed gauze lightly against the insertion site, checking for bleed-through. Enough. Not evasive. Not detailed. Final. He studied her a moment longer. The resident interrupted, focused on the wound. I need suction. It was already in her hand. Activated. Positioned. Ready before he finished speaking. He took it without looking. The officer's eyes shifted to the machine, then back to her. Timing like that didn't come from routine hospital work alone. It came from pattern prediction. Training. Experience under pressure. He filed that away. The patient's heart rate ticked up again. Erin saw it before the monitor alarmed. Her fingers rested lightly against the mattress beside his arm. Not touching him. Present. Grounding. The numbers stabilized. The officer saw that too. Silence settled again, but it wasn't the same silence as before. Earlier, it had been procedural. Now, it was evaluative. He wasn't just guarding a patient anymore. He was reassessing the room. And at the center of that reassessment was the quiet nurse no one had introduced. The room did not feel crowded. It calculated. That was the only word for it. Every person inside Trauma 3 had unconsciously adjusted their position around the bed. The resident leaned closer to the wound. The assisting nurse shifted toward the medication tray. The officers maintained their silent perimeter. And Erin stood exactly where she had been. Not because she hadn't moved. Because every movement she made returned her to that same point of balance. Her gaze drifted once across the officers again. Not staring. Logging. The one near the wall carried weight slightly forward on the balls of his feet, ready to move fast, not brace. The one at the door kept his chin angled just enough to preserve peripheral vision down the corridor. The senior officer's hands hung relaxed, but his thumbs rested near his belt seam instead of hooking inside it. None of them spoke. Which meant they were communicating. Professionals who trained together long enough didn't need words. Micro-shifts did the work. Breath timing. Eye flicks. Shoulder angle. She recognized the language because she had learned it before she ever learned hospital triage. The patient's pulse fluttered beneath the light touch of her fingers. She didn't look down. She counted. Rhythm irregularity. Not cardiac. Cognitive. He was thinking. She spoke quietly, not looking at him. Stay with the breathing. His chest rose. Fell. Stabilized. Across the bed, the resident continued working. Pressure holding. That's good. Erin adjusted the fluid rate slightly. Not enough for anyone else to comment. Enough to maintain perfusion without accelerating bleed risk. The senior officer noticed. His eyes narrowed a fraction. Not suspicion. Assessment. He shifted 1 inch closer, not threatening, just within clearer observation range. Up close, details sharpened. Her hands showed faint compression marks along the webbing between thumb and index finger. Repeated pressure exposure. Not from forework. Different angle. Different pattern. Her posture never leaned into the patient, never crowded him. She left him space even while treating him. Control professionals understood space. They respected it. He watched her scan the room again. Door. Hall. Officers. Equipment. Back to patient. Not nervous scanning. Structured scanning. That confirmed something for him. He said quietly, "You track exits every 30 seconds. It wasn't a question. Erin didn't look up from adjusting the monitor lead. Yes. No explanation. No apology. Just acknowledgement. The assisting nurse glanced between them, confused. Track exits? Aaron smoothed tape along the patient's foreline. Habit. The other nurse shrugged and returned to charting. Hospitals were full of habits. Counting respirations. Checking wristbands twice. Repeating medication names under breath. No one pressed her. But the senior officer didn't look away. He filed the answer. Habit. Not training. People who said training wanted recognition. People who said habit didn't. The patient's eyes shifted toward the door again. Aaron saw it. Her own gaze followed, indirectly, through the reflection on the metal instrument tray. Movement outside. 2 figures passed. Civilian clothes. Walking pace wrong for visitors. She leaned slightly toward the resident. We may need privacy curtain. He frowned. Why? Light glare. He glanced at the overhead lamp and shrugged. Sure. She reached up and drew the curtain halfway around the bed. Not closed. Just enough to distort outside sight lines. From the hallway, the bed would now appear partially obscured by fabric folds and reflected light. Inside the circle, visibility remained perfect. The senior officer watched that adjustment carefully. That was not a lighting correction. That was environmental control. He stepped closer again. You've worked secure transports, he said quietly. Not a question this time. A statement. Aaron pressed 2 fingers gently against the patient's wrist again, checking pulse strength after the fluid adjustment. Yes. How long ago? She lifted her eyes to him. Long enough. Again, final answer. He studied her face. No ego. No tension. No attempt to impress. Only stillness. Behind him, one of the officers shifted his stance slightly, mirroring his superior's attention without realizing it. Authority rippled through teams like that. Subtle. Automatic. The patient swallowed. Dry. Painful. Aaron picked up a sterile swab, moistened it, and touched it lightly to his lips. Minimal water. Enough. He exhaled slowly through his nose. Relief. Not gratitude. Trust. The officer saw that. That was new. Detainees did not trust medical staff quickly. Not restrained detainees. Not injured detainees. Not guarded detainees. Yet this one had calibrated himself to her presence in under 3 minutes. That meant something. He lowered his voice. You know what he is? Aaron disposed of the swab wrapper neatly. Yes. The officer waited. She didn't elaborate. Didn't ask if she was correct. Didn't ask if she was allowed to know. She simply returned her attention to the patient's monitor. The officer's eyes sharpened. How? Her answer came without hesitation. Shoes. Knots. Formation. Silence. 4 data points. Delivered like vital signs. He held her gaze a moment longer. Then. What do you think he is? She adjusted the blanket edge to prevent pressure against the wound dressing. Important enough, she said calmly, that mistakes will not be forgiven. Silence. Not tension. Recognition. He gave the smallest nod. Across the bed, the resident finally looked up from his work. I'm going to need imaging after this. CT, maybe vascular. One of the officers spoke immediately. Movement needs clearance. The resident blinked. From who? No answer. Aaron watched the patient's heart rhythm change again. Faster. Not fear. Anticipation. Something was about to shift. She felt it the way pressure changes before a storm. Not visible. But measurable. Her fingers rested lightly on the bed rail again. Grounded. Ready. Outside the curtain, footsteps approached. Not passing by. Approaching. Multiple. Coordinated. The officer nearest the door straightened fully now. The senior officer turned his head slightly toward the sound. The patient's pulse accelerated beneath her touch. Aaron spoke softly, barely above a breath. "Stay still." The patient obeyed instantly. The footsteps stopped directly outside the bay. A voice murmured something low. Official tone. Then. A knock. Not loud. Not hesitant. Deliberate. Every officer in the room shifted their attention toward the door. Every officer. Except Aaron. She was watching the reflection in the metal tray. Because reflections showed intention. Before doors opened. The knock came again. Same rhythm. Measured. Certain. Not a request for entry. A notification. The officer nearest the door stepped forward and pulled the curtain edge aside just enough to see through the glass panel. His posture changed instantly, not alarmed, not aggressive. Focused. He opened the door halfway. 2 men stood outside. Plain clothes. Dark jackets. No visible insignia. But they didn't look like visitors, and they didn't look like hospital administration. They stood like men who expected doors to open. One of them spoke quietly. The officer nodded once. No one raised their voice. No one announced anything. But something shifted in the room. Pressure, not sound. Aaron watched the reflection. The new arrival's shoes were polished but creased at the toe. Not ceremonial. Field wear disguised as formal. Their jackets hung slightly heavy at one side, weight distribution consistent with concealed equipment. Not local. Not hospital. Federal. Her eyes returned to the patient. His pulse had climbed again. Not panic. Recognition. She lowered the fluid rate by a fraction. Too much pressure too fast would risk reopening the wound. Across the bed, the resident said, "We need imaging soon." The senior officer didn't look at him. He was watching the doorway. The 2 new men entered. They didn't walk like strangers entering a clinical space. They walked like they were stepping into a perimeter they already understood. Their eyes moved once across the room. Patient. Officers. Equipment. Exit. Staff. When their gaze reached Aaron, it stopped. Not long. But long enough. One of them spoke quietly to the senior officer. Too low for the resident to hear. Too controlled for lip reading. The senior officer's expression didn't change. But his shoulders lowered half an inch. Acknowledgement. Authority recognized. Aaron didn't watch them now. She watched the patient's breathing. Shallow again. Muscle tension building along his jawline. Pain spike. Or stress spike. She adjusted the blanket edge again so it didn't press the wound. Small action. Large effect. His breathing steadied. One of the new arrivals stepped closer to the foot of the bed. He looked at the monitor. Then at the dressing. Then at the restraint still secured on the patient's other wrist. Then at Aaron's hands. His eyes narrowed slightly. Not suspicion. Evaluation. He spoke to her directly. Condition? Single word. Neutral tone. No introduction. No explanation. She answered without looking up. Stable if undisturbed. He absorbed that. What destabilizes him? Movement. Noise. Delay. 3 variables. Delivered clinically. He nodded once. The resident glanced between them, confused by the exchange. I still need imaging clearance from someone. No one answered him. The second plainclothes man stepped toward the senior officer and murmured something again. Short. Precise. Operational language. The senior officer gave a single nod. Then he looked back at Aaron. You said minutes earlier, he said quietly. Update. She checked the patient's capillary refill again. Pulse. Respiration. Skin tone. All systems compensating, she said. Window extended. How long? She considered. Not guessing. Calculating. Long enough if variables remain controlled. He studied her face. She wasn't trying to reassure him. She was giving him a tactical parameter. He understood that language. Behind him, the first plainclothes man shifted his stance slightly, bringing himself into clearer view of her line of sight. Testing. She didn't look at him. Didn't acknowledge him. Didn't react. Her focus stayed on the patient. The test ended. He glanced once at his partner. Subtle. But Aaron saw it in the reflection. Silent confirmation passed between them. The patient swallowed again, throat tightening. Pain. Her hand moved instantly to support the dressing pressure point, not pressing harder, just redistributing force to prevent strain. The cardiac monitor tone smoothed. The man at the foot of the bed noticed. His gaze sharpened. You've done trauma under custody before, he said. Yes. How many times? Enough to know noise is worse than blood loss. Silence. The senior officer's eyes flicked once toward the hallway. Footsteps echoed faintly outside. More arriving. The resident finally spoke, frustration edging in. I can't treat a patient inside a mystery. Someone needs to tell me what's going on. No one answered him. Aaron said quietly, Doctor. He looked at her. Continue treatment. Her tone wasn't commanding. It was steady. Grounded. Anchoring. He exhaled once and nodded, returning to the wound. She had given him something more useful than information. She had given him stability. The second plainclothes man shifted his attention back to her. Not curiosity now. Recognition. He spoke softly to the senior officer. The words were almost inaudible. But the effect was visible. The senior officer's eyes moved back to Aaron. Stayed there. Measured. Reassessing everything he had assumed about the room when he first walked in. The patient's pulse quickened again beneath her fingers. Not from pain. From anticipation. He was listening. Waiting. For something. Aaron leaned slightly closer to him. Her voice was barely sound. Not yet. His breathing slowed instantly. The senior officer saw that. So did the man at the foot of the bed. Neither spoke. Outside, more footsteps approached. Heavier. More numerous. Not rushing. Organized. The air in the trauma bay tightened again. The senior officer looked toward the door. Then back to Aaron. For the first time since entering. He asked her a question with real weight behind it. Is there anything, he said quietly, we should be preparing for? She adjusted the edge of the tape securing the 4-line. Smoothed it once. Then answered. Yes. He waited. She finally lifted her eyes to his. Her voice remained calm. Interruption. The footsteps stopped outside the door. And this time. They did not knock. No knock. That was the first confirmation. People who belonged inside medical spaces knocked. Even when they had authority. Even when they were angry. Even when they were late. Silence outside a closed trauma bay door meant only one thing. Someone believed they didn't need permission. The senior officer turned toward the entrance. The plainclothes men did not move. They were already ready. Inside the circle of curtain-filtered light, the patient's pulse accelerated beneath Aaron's fingers. Not fear. Recognition again. He knew that presence. She leaned slightly closer to him. Stay with breathing. His chest rose. Fell. Stabilized. The handle began to turn. The resident looked up. We're sterile. The door opened anyway. 3 more men stepped inside. Dark suits. No hospital badges. No hesitation. Their eyes moved quickly across the room, not confused, not curious. Targeted. They weren't searching for the patient. They were searching for control. The first one spoke. We're taking custody. His tone wasn't loud. It didn't need to be. The resident blinked. He's in treatment. We'll be quick. That was when the senior officer spoke for the first time since they entered. No. One word. Flat. Final. The suited man turned toward him slowly. Excuse me? This patient remains under current supervision. The suited man's expression didn't change. But something behind his eyes hardened. Jurisdiction has shifted. The air changed temperature. The resident looked between them, lost. I don't care who has what. He's bleeding. No one acknowledged him. Aaron checked the patient's pulse again. Faster. Irregular now. Stress spike. Not physical. Situational. The suited man stepped forward. We'll handle transport. The senior officer didn't move. You don't have clearance. The second suited man spoke quietly. We do. He reached inside his jacket. Not for a weapon. For paper. He unfolded it slowly. Official letterhead. Signature block. Seal. He held it out. The senior officer read it. His eyes moved once across the page. Then again. Something tightened in his jaw. Behind him, one of his officers shifted his stance subtly, ready but restrained. The resident looked at Aaron. We need to move him to imaging now or we risk missing vascular damage. She didn't answer. Her attention was on the patient's breathing. Shallower again. She adjusted the bed angle 3 degrees. Better perfusion. The senior officer handed the paper back. Timing is unacceptable, he said. It's authorized, the suited man replied. That doesn't make it safe. That doesn't make it optional. Silence. 2 chains of authority facing each other. Neither loud. Neither emotional. Both immovable. The patient's pulse stumbled. Aaron saw it before the monitor chirped. Her fingers pressed lightly against his wrist. Grounding contact. His rhythm steadied slightly. But not enough. The resident's voice tightened. He needs imaging. Now. No one moved. Because movement meant control. And control was what both sides refused to surrender. Aaron's eyes moved once across the room. Door, blocked. Officers, divided attention. Suits, forward pressure. Doctor, losing time. Patient, losing margin. Her decision formed quietly. Not dramatic. Not rushed. Just complete. She spoke. Doctor. He turned instantly. We are moving him. The suited man frowned. No, you're not. She didn't look at him. She was already unlocking the bed wheels. The senior officer's voice came low. Nurse. She met his gaze. Calm. Certain. If he stays, she said, he deteriorates. The suited man stepped closer. You don't have authority to. She cut him off. Not louder. Just firmer. If he moves with delay, she said, he bleeds internally where you cannot see it. Silence. No one liked variables they couldn't see. The resident swallowed. She's right. The suited man's eyes hardened. This is not a medical decision. Aaron finally looked at him. Fully. Directly. It is. No anger. No defiance. Just fact. The patient's pulse faltered again. Her hand tightened slightly around his wrist. Not restraining. Stabilizing. The senior officer watched her. Watched the monitor. Watched the patient. Then he asked the question that mattered. If we move him, he said quietly, what do you need? She answered immediately. Clear hallway. No voices. No stops. No questions until imaging. He nodded once. Decision made. He turned to his team. Clear route. They moved instantly. No discussion. No hesitation. The suited men stepped forward at the same time. No, the first one said. The officer near the door blocked him. Not aggressive. Immovable. This movement is happening, the officer said calmly. The suited man looked at the senior officer. You're violating a transfer order. The senior officer didn't raise his voice. File it. Silence. Power shifted. Not loudly. Not visibly. But completely. Aaron began guiding the stretcher toward the door. Her hands steady. Her breathing slow. Her attention on the patient's pulse. Behind her, authority structures collided in silence. Beside her, the patient's rhythm steadied again. Ahead of her, the hallway waited. The suited men did not move aside. Not yet. And that was the next problem. The stretcher rolled forward 1 inch. Stopped. Not because Aaron hesitated. Because the path was blocked. The suited men did not step aside. They didn't raise their hands. They didn't threaten. They didn't speak. They simply remained where they were. That was enough. Hospitals were built on motion. Gurneys moved. Staff moved. Patients moved. Anyone who stopped movement without explanation changed the gravity of a room. The officer at the doorway shifted slightly, ready to intervene. The senior officer did not move yet. He watched. Not the suited men. Her. Aaron's hands rested lightly on the stretcher rail. Not gripping. Balanced. The patient's pulse beat steady beneath her fingers now. Still fragile. Still narrow margin. But holding. She did not push again. She did not demand space. She waited. The first suited man spoke. This transport is under federal reassignment. No one answered. His eyes moved to her badge. Then back to her face. You need to step away. Her gaze remained on the patient's monitor. No. Quiet. Unemotional. Final. The suited man's jaw tightened. You're interfering with an active transfer order. She adjusted the blanket edge so it didn't pull against the 4-line. No hurry. No tension. Just precision. You are delaying treatment, she said. The second suited man took 1 step closer. His voice dropped. You don't understand the situation. That was when she looked at him. Not sharply. Not dramatically. Just directly. I do. Silence. The room seemed to narrow. The senior officer's attention sharpened. The suited man studied her face. Assessing confidence. Testing for bluff. Finding neither. What situation is that? He asked. Her answer came in the same tone she had used all night. Clinical. Measured. Certain. The kind where paperwork arrives faster than clearance. The sentence was simple. But it landed with weight. The suited man's eyes changed. Not anger. Recognition. She continued, still calm. If you interrupt perfusion stability now, she said, you will lose your asset before jurisdiction matters. She did not emphasize asset. She didn't need to. The word itself did the work. Behind the suited men, the senior officer's posture shifted. Very slightly. Understanding. Not of her authority. Of her knowledge. The second suited man's gaze sharpened. Who briefed you? No one. Another pause. The first suited man's voice lowered further. Then how do you know what he is? She held his gaze. Did not blink. Then she said one sentence. Quiet. Precise. Unmistakable. Because I transported him the first time. Stillness. Total. The words did not echo. They settled. The senior officer's eyes widened by less than a millimeter. The officer beside the door inhaled once, softly. The suited men did not move. But something inside their stance changed. Verification. Recalculation. She didn't elaborate. Didn't reach for identification. Didn't explain. She simply rested her hand lightly against the patient's wrist again, monitoring rhythm. Waiting. The first suited man spoke carefully. Name. She answered. Not loudly. Not formally. Just the name. The effect was immediate. Both suited men stepped aside. No protest. No discussion. No acknowledgement. They moved the way trained personnel move when hierarchy clarifies. Instantly. The senior officer watched them. Then looked back at her. Understanding settled fully now. Not surprise. Recognition. He stepped back as well. Not because he was told to. Because protocol had just rearranged itself. Erin didn't react to any of it. She simply began pushing the stretcher forward again. The wheels rolled smoothly across the floor. The patient's pulse remained steady beneath her fingers. No one spoke. No one announced anything. No badge had been shown. No authority declared. But every person in that room now understood the same thing. The quiet trauma nurse they had been questioning all night was the one person there. No one outranked. The hallway was clear. Not empty by accident. Cleared. Overhead lights reflected softly off polished floors as the stretcher rolled forward. No footsteps followed too close. No voices called out. Even the usual intercom announcement seemed to wait. Erin guided the bed at a steady pace. Not fast. Never fast. Speed created instability. Instability created mistakes. Her left hand steered. Her right rested lightly against the patient's wrist. Pulse steady. Still fragile. Still within margin. Behind her, the officers walked in silence. Not crowding. Not escorting. Maintaining distance the way professionals did when they understood the person in front no longer required supervision. The suited men followed even farther back. Not leading. Not directing. Waiting. The CT suite doors opened before they reached them. Someone inside had been warned. Not by announcement. By tone. A technician stepped aside immediately. No clipboard questions. No intake delay. Just space made where space was needed. Erin guided the stretcher into position. On my count, she said quietly. The tech nodded. They transferred the patient smoothly, sheet tension balanced, spine aligned, tubing slack preserved. No jerks. No sudden elevation changes. No loss of rhythm. The monitor tone remained steady. Only once the patient was positioned did she remove her hand from his wrist. She adjusted the edge of the dressing one final time. His eyes opened slightly. Focused. On her. Not fear. Not confusion. Recognition. He didn't speak. Neither did she. She simply gave the smallest nod. His breathing slowed. CT staff moved into place around the scanner. The senior officer remained near the doorway. Watching. He didn't interrupt. Didn't question. Didn't assert rank. He had seen enough to know when command didn't need to be stated. Erin stepped back from the table. Checked the 4-line once more. Verified flow. Then she turned away. Not ceremonially. Not slowly. Just done. The senior officer spoke quietly behind her. Ma'am. She stopped. Looked at him. Respectful. Neutral. Not expectant. He held her gaze a moment. Not inspecting. Acknowledging. You could have identified yourself earlier. Her answer came without pause. They were treating him. No pride. No lesson. Just reason. He nodded once. That made sense. Operational priority over recognition. He understood that language. Understood, he said. She inclined her head slightly. Then she walked past him. No escort. No audience. Back into the hallway. The suited men stepped aside automatically as she passed. They did not speak. They did not stop her. They did not ask for confirmation. Because they no longer needed it. Her pace remained the same as before. Measured. Quiet. Unnoticed by anyone who didn't know what they were seeing. She turned the corner. Disappeared down the corridor. No dramatic exit. No final glance. Just absence. 10 minutes later, back in Trauma 3, the resident finally exhaled. What just happened? No one answered. One of the nurses checked the staffing board mounted beside the supply cabinet. Her finger traced the list. Night shift roster. Trauma float coverage. She frowned. Looked closer. Her name's not here. The resident stepped over. What do you mean? She signed in earlier, the nurse said. I saw her badge. He scanned the board. Every name printed. Every shift assigned. No Erin. Behind them, the senior officer stood in silence. Watching the empty doorway she had walked through. He said nothing. Did nothing. After a moment, he turned and left as well. No report requested. No clarification demanded. Because some authority did not belong to paperwork. And the ones who recognized it never needed it explained.